if you eat 5 to 6 prunes a day, you're able to maintain bone mass, particularly at the hip, because that is what we saw in our study. And that does translate to some findings with respect to structural benefits to bone. So I think those are important benefits that we need to educate and get messaging out to women. So why not Osteoporosis Month? It's an important time to get this kind of messaging out there. Mary Jane De Souza, Distinguished Professor in Kinesiology and Physiology here at Penn State University. Osteoporosis Awareness Month is a time period during which organizations here and abroad who are interested in prevention and education or treatment around osteoporosis and all the problems associated with osteoporosis spread awareness. And I think it's very, very important because it's a disease that's largely silent and occurs in the absence of someone knowing what's going on. Osteoporosis is a disease that affects your bones, whereby the bones become less strong and at risk for fracture. And fracture is the bottom line thing you want to avoid. And by keeping your bones nice and strong, you can avoid fractures. So it turns out that women lose more bone during the time period called perimenopause. And we call that the menopause transition. So when women are transitioning to that final menstrual period, so even before the final menstrual period, the process of bone loss has well initiated. And it's very problematic because in the 3-year period right before the final menstrual period and the couple years right after, women lose more bone than at any other time in their life. In fact, it's as much as 9 to 10% of bone mass. We're currently doing a USDA randomized clinical trial that's focused on trying to slow down that super rapid period of bone loss that starts before menopause. And we're trying to do that by asking women to eat prunes for 18 months. Now this is interesting because it's not medicine, and because women can't get medicine to prevent loss, they can only get it to treat bone loss, options become limited. So I've been very interested, are there some whole foods, are there strategies that are accessible to all women that they could do and take it upon themselves to try and prevent or slow down this time period of bone loss. So we're asking them to eat 5 to 6 prunes a day for a year and a half, because we completed a study a few years ago in women who were older than the women who are transitioning. So these are postmenopausal women. The average age was 62, 63. And we asked them to eat 5 to 6 prunes a day and for 12 months. And we saw that they were actually able to preserve their bone. In other words, they did not lose bone across that 12-month period, whereas the control group, who were just consuming calcium and vitamin D, lost close to 2% of bone in that 12-month period, which is what you would expect to see. Postmenopausal women, 1 to 3% of loss per year. That's what we saw in the control group. But we were able to completely stop that and preserve bone. And it was observable as early as 6 months into the intervention and persisted through our 12-month time period. So that's pretty exciting. Prunes are thought to benefit bone because they are anti-inflammatory. They have a component in them called polyphenolics or phenols, and these are potent anti-inflammatory agents. And if you consider that during the menopause transition, inflammation goes way up. And part of osteoporosis is caused not only by estrogen but by inflammation, and we think the prunes are working largely by decreasing all of that inflammation that's going on. When you're treating bone loss, you've lost mass and you start out down here. At that point, can you increase bone mass? But if you're increasing it just a little bit with pharmacologic medications, which do a wonderful job, why not try and do things when your bone mass is up here to maintain what you've got, so that if you lose a little bit, if we're able to attenuate loss from here to here, and now we get it only to here, when women engage and go through that menopause transition, they're starting off at a much higher bone density and better bone quality. That makes a huge difference when you're trying to prevent fractures. Want me to hold the bag behind it? Kind of backdrop? I'll tell you after. Do you guys put it together in clips?